Welcome everyone. My name is Janine Rios. I work for Share Our Strength and No Kid Hungry campaign. Thank you so much everyone who's taken the time to join our webinar. Today we are focusing on tribal communities and lessons learned from COVID-19, strategies for back to school, and also about just the communities in general. Next slide, please. So some of you may or may not know who Share Our Strength is and what the No Kid Hungry campaign is all about. And basically Share Our Strength is the organization and No Kid Hungry is the campaign that we run nationwide. We work with different partners to improve access to federal nutrition programs at the schools so that kids won't go hungry and they'll take advantage of meals that they need to work, grow, and play. Through proven and effective campaigns, we're able to connect people who care about this work to other partners and really make an impact in improving these strategies. Next slide, please. So the agenda today, we're going to go over a little bit of housekeeping as it pertains to the webinar. We're going to highlight some of our No Kid Hungry resources. And then we are going to start with our presenters. And the first presenter will focus on Gila River Indian Community in Arizona. And the second group of presenters will talk to us about St. Michael's Indian School. And then we'll have some time for question and answers. Next slide. So this may be the most important slide, the housekeeping. If you have any technical difficulties, please use the chat box, and we have our Share Strength person from behind the scenes that can help you with any difficulties you have. This webinar is being recorded, and after the webinar, everyone who is participating will get an email with the slide deck and the recording. So during the webinar, if you have questions for the speakers, please use the question and answer box, and we'll get to those after everyone has presented. Next slide. So one thing that we wanted to highlight, and we're sure that most everyone has become aware of the waiver extensions by now, but if you have not, on October 9th, the waivers were extended. USDA sent out a notification, and with this slide, you'll be able to click on it and get all the details. But some things we wanted to highlight are that this extension includes the waivers allowing schools and nonprofit sponsors to utilize the summer meals program during the school year, regardless of school operational status. So the USDA has extended those waivers to support safe and efficient operating status. Using these, we can, provide meals to more kids, and food service programs and summer seamless options like the non-congregate and area eligibility and meal service time waivers were also included. So these are the waivers that were set to expire in December 31st, but now they're available until the end of June 30th, 2021. So we are super excited about this. We applaud the USDA for acting quickly on its extended authority in order to help schools and sponsors better plan for this school year. As we know, it's been quite unpredictable. So thank you for that. Here are some of our resources we wanted to highlight today. They're the most recent that have come out. And you can find them at our website, bestpractices.nokidhungry.org, Coronavirus Response Recovery, Back to School. And one that we're going to highlight today is the School Meals Marketing Toolkit. It just came out hot off the presses today. Next slide. Just to give you a little sneak peek, it has different types of marketing already prepared, resources in English and in Spanish. This is not all of them, but this is just a few that you can just plug right in to your social marketing, to social media campaigns on your website. You don't have to recreate the wheel. You can just take these, use them in your community to increase meal participation and the word that you have meals available at your schools. So hopefully you'll be able to use these. And we have the link that I just showed you on the last slide, so please feel free. Next slide, please. So I would love to introduce our panelists to you today. I'm going to go over all the panelists, and then we're going to start with Denise. We want to welcome them and just thank them not only for their time and their expertise, but all that they do every day out in the field. Our first presenter is Denise Desiderio, and she has, honestly, her resume was so long, I had to just really pick and choose because she has so much experience. She has 15 years of experience advising on American Indian policy and regulations. She's served as the Deputy Staff Director and Senior Counsel for the Senate Committee on Indian Affairs. She's served as Policy Director for the National Congress of American Indians. She's a member of the Saponi Tribe and the Tribal Governance Project, charged with revamping the tribal constitution. Denise has a long resume, including many areas of expertise, and we're just honored and grateful to have her here to speak to us today about her work. Thank you, Denise. Next, we have Melissa Key, and she's the FNS Director at St. Michael Indian School. She has 13 years of service to the school in the food service. She became the director in 2015. And prior to that, she worked at the St. Michael's food service industry for 22 years with experience at other educational institutions, in restaurants, and in healthcare food service. So she has a wide range of experience. And next slide, please. So next we have Dee Weber, and she is the nutritionist specialist for St. Michael Indian School. She has 5 years of service to the school, and this includes a short time in the advancement office with 4.5 years with the food service department. Dee's background in health and nutrition complements her work. She's currently pursuing her Bachelor's of Science in Healthy Lifestyle Coaching at Arizona State University, and she is alumnus of St. Michael Indian School, full circle. And then last but not least, we have Renee Ticini. She's a director of corporate, foundation, and public relations for St. Michael Indian School. She has 11 years of service there, including her work in the advancement office. Her background in financial banking and retail experience enhance her role in grant management, communication, marketing, and donor relations. She has a Bachelor of Liberal Arts and a Science in Liberal Arts from Arizona State University. Before we get started, I just wanted to address, when we're talking about food insecurity, I would be remiss if I did not mention the deep-rooted systems of racial oppression that have contributed to our current situation of who goes hungry. We have all been affected by coronavirus in some way. And in this nation, we've seen how marginalized communities have been hit the hardest due to disparities in health, wealth, and social capital. And a recent CDC report listed that tribal nations are one of the racial and ethnic groups at highest risk from COVID-19. They found an incident rate for tribal populations 3.5 times that compared to non-Hispanic whites. Contributions they found out were noted as racial inequity, historical trauma, social economic factors. So just keeping in mind, like, you know, some of the root causes of food insecurity. I believe our panelists will touch on these disparities either directly or indirectly as they speak today. And with that, I say, Denise, take it away.
Good afternoon, everyone, and thank you for allowing me to participate in this webinar today. My approach today will be from the perspective of the Gila River Indian Community's tribal government, because when we talk about schools, when we talk about school nutrition, we're really talking about community nutrition. So I wanted to highlight some of the issues that have become prevalent during COVID, but also those that have existed, long-term issues that have existed on the community, and how the community has been addressing them from the lens of COVID and providing food, nutrition services for students, but also for the community as a whole. I want to tell you a little bit about the Gila River Indian community. Next slide, please. The Gila River Indian community is located outside of Phoenix, Arizona. And you might say that Phoenix has now come to meet the community. It used to be that the reservation and Phoenix were separate, and that there was quite a distance between the city and the tribe and the reservation. But now the outskirts of Phoenix actually abut the reservation. So Gila River is what I would consider a microcosm of Indian country. It is both impacted by rural issues, also urban issues. It has a large land base with 372 square acres and a total tribal membership of 22,000, with 14,000 of those members living on reservation. The majority of the members living off reservation are in the Phoenix and local area. The tribe has a complex government. The government is made up of 7 districts. And those districts elect their representation based on population. So there are 17 elected members of the community council, and then there's also an election for governor and lieutenant governor. And within that structure, the community council makes the governmental decisions for the community. But I think it's important to understand that the community has a very sophisticated government. There is Gila River Healthcare, a 10-facility healthcare system that serves up to 100,000 tribal members each year, both from Gila River and also from other tribes. There's a number of tribes that live in the Arizona area, tribal members that will come to Gila River for healthcare needs. That's important because when COVID hit, we first thought that this was going to be a healthcare issue, right? But what we found was that there was a necessity to take over governmental control and have a comprehensive and outreach and a coordinated effort to deal with all of the issues. And you'll see that in how we dealt with the meal services and how the schools are functioning. There's public safety, social services, environmental quality, economic development, enterprises. Initially, I think it was the end of January, beginning of February, the community created a COVID task force, COVID-19 task force. And that task force is made up of all of those entities along with the school, the director of education for the community, because right away it was clear that this was going to impact the community schools as well as all of the other areas. Next slide, please. So here's a look at the schools on the reservation. There are 7 schools on the reservation. 3 of those are Bureau of Indian Education schools. And for those not familiar with BIE, that's a federally run school system. BIE schools are the only other federally run system aside from Department of Defense schools in the United States. It's one of the oldest school systems in the United States, and it began actually in the 1800s when reservations were formed and the government decided to take control of tribal students. And I would have to say it was mostly for the idea was to westernize youth, tribal youth. So the Bureau of Indian Education system has 183 schools throughout the United States, and 3 of those are on the Gila River Reservation. There are also 2 public schools that are state-run, a charter school that's chartered under the state, and a parochial school, with a total population of up to 2,000 students per year. There are no high schools on the reservation. There are only K through 8. And then the students have to transition off the reservation, which has created an issue when you're trying to control the education for the students, as well as the meal plans during, virtual school and a few other issues. Next slide, please. I don't know if this is easy to read, so I'll highlight a couple of numbers and why I wanted to show this slide. This is the Gila River's data report. We get this report daily from the Tribal Health Department and Gila River Healthcare. Initially, I think we all have come to realize that there's been a lack of a federal plan for testing and for responses to COVID. So it became apparent early on that the community was going to have to create its own systems, responses, and solutions to COVID. So you can see here that the community has performed a total of 95,000 tests. I think we're probably going to hit 100,000 this week. 898 of those tests of the positive, 898 tribal members have tested positive for COVID, and 1,245 members either on reservation that aren't tribal or through the Gila River Healthcare have tested positive, and we've had 25 deaths on the reservation. What I think is really interesting about this slide, if you look at the bottom, the number of positive cases, 341 of those are in the 20 to 44 age range, and 215 are under 20. So those statistics are a little bit different. I know the CDC report that Jenny mentioned earlier indicated that tribal youth are being impacted by COVID at a higher rate than any other population. And you see that is the case at Gila River as well. That's one of the reasons that the community decided early on that it needed to close the schools on the reservation, go to virtual learning. After a brief reopening of the tribal government and the tribal enterprises, the community shut down again. I think they were open for about a month. So for the majority of the last 8-month period, for the entire time, schools have been virtual learning since last March. Next slide, please. So as the government was contemplating kind of how to handle schools, there are a couple things to consider. Governor Lewis, the governor of the reservation, issued a stay-at-home executive order, and that is for the entire reservation. So members are encouraged to stay home except for travel to and from work. The tribal government remains closed except for essential services. There's a mask requirement. Gila River was one of the first jurisdictions to reinstitute a mask requirement after the state declined to do so. So that mask requirement is inside and outside of buildings and facilities on the reservation, and it extends throughout the reservation. There's an executive order that virtual school will be through at least November 30th. And what's important to note is that Gila River ended up exercising jurisdiction over all of the schools. So earlier I mentioned there's parochial public reservation schools. The community, through Governor Lewis's executive order, exerted jurisdiction over all of those schools. That's a little bit unusual, but the community is of the mind that they are responsible for all the students on the reservation, not just those that are in BIE schools. So that was how they created their virtual plan and decided to go from there. It's not easy telling a nun who says she reports to God in the diocese that you're exerting jurisdiction, but that is exactly what the community did for the well-being of the teachers, the school officials, and the students and the families. Many of the students at Gila River live with their elders, live with their parents. There are extended families generally in the home or nearby or next door. So for the safety of the entire community, there was a decision made to close schools. But that created an issue for the entire community, not just for the students. And one of the issues was, how do we make sure that they're still getting food delivery? Many of the students have breakfast and lunch at the school, and they rely on that. If you add that to the fact that many of the members on the reservation work for the tribal government or enterprises on the government on the reservation, we realized early on that you weren't just going to be feeding the student, you were going to be feeding the younger siblings, grandparents, and families. So the community made the decision to utilize USDA funding and also tribal relief funding and make sure that the family was fed, not just the students, but the entire family was fed. So each day there is pickup of breakfast and lunch at the school, along with student packets and whatever needs to be exchanged between the school and the families. And also that there is enough food for the family as a unit. So that's kind of how the community has been dealing with that. One of the other issues that came up was broadband. There are 2,200 households on the reservation, and we found that it was necessary to make sure that there was enough internet to have telehealth and educational learning. So right now, the community has used its resources to pay for broadband for each household through the end of the year at least. So I think one of the reasons I wanted to talk about the community as a whole is because that's exactly how these decisions need to get made. You can't isolate the school. The school is often also the gathering place for community events. It's sometimes where cultural gatherings occur. So in the community, you can't say, well, we're just going to feed, 1 out of 5 children. You have to have a comprehensive plan for everyone. Likewise, with tribal employees, the communities, Gila River Healthcare is where a lot of the tribal employees would go and eat lunch and have a healthy lunch. And those resources are often provided by some of the community's farms, Ramona Farms, Gila River Farms, to make sure that there are cultural components added to the menu. So that's something that our families were missing out on. And at Gila River, they have the highest incidence of diabetes in the world. So healthy programming through Gila River Healthcare, healthy menus are included in the lunches that are served to the children and the families. So there's a lot that goes into the decision outside of, is there funding to provide food for that student? Next slide. This is a picture of one of the schools on the reservation. And I show you this, and please don't be distressed. We're building a new school. We broke ground last week and using a really innovative new program that Gila came up with. But this is the school that the students would go to. And I say this to illustrate that there will be a long-term issue with COVID. I know that there is some thought that students can go back to school. I know some places they are. At Gila River, nobody is rushing to send students back to a school that has improper ventilation and would be, and next slide, and would be really detrimental to student health. So I know that right now the executive order covers through November 30th because the idea was to get it past the holiday. But I anticipate that the students will be at home probably through the spring, at least until vaccines are widely available, and which is one of the disparities that Janine brought up earlier. I think one of our efforts over the next couple months will be to make sure that tribal governments are included as recipients of vaccines, because I think that there's a tendency to leave tribes out and expect tribes to come under state and local governments, but that generally doesn't work out well for tribes. So that's why when we're coming up with solutions for long-term issues related to nutrition for students in the community, we have to emphasize the government-to-government relationship and not have tribes reliant on state governments to provide for their needs. Next slide. I wanted to briefly hit on a few things that we're working on behalf of Gila River and other tribes across Indian country. And one of those is self-governance programs for tribes. Based on my description, you can see that what needs to happen is the government needs to be able to make the decisions on how to utilize, implement, and where programs are best needed. Having self-governance at USDA is something that has been desirable for a long time. There's been some reluctance from federal partners. There is sometimes a view that tribes don't have capacity to carry out these programs. If I leave you with nothing else today, please know that tribes have the capacity to carry out the programs that are the best for their members. There are a lot of folks who like to say local decision making is best. That is never truer than with tribes, because even the relief fund that was received, if you silo programs, sometimes it doesn't go where it's needed. When we thought about our schools, we thought about food first. How do we make sure the families and the students are fed? Broadband, how do we make sure they have the education? Testing, how do we make sure that students and teachers are part of the comprehensive tribal testing plan and don't rely on BIE or the state or somebody else to provide that for the students? And how to make sure that all of the students feel safe, either at home or some of the students with special needs, we're making special arrangements for them to have special one-on-one arrangements so that their needs are met too. So self-governance programs for tribal nations at USDA throughout the federal government are the #1 priority. Flexible use of COVID and other funding. There are some restrictions that are preventing us from expanding programs the way we would want. And there's also a timeline. So when you hear about state and local relief funding that's being talked about a lot right now in DC, tribal funding is also part of that. And then tribal jurisdiction over all reservation schools. From my time in the Senate, I've always thought that tribal leaders have responsibility for all of the students on the reservation. That you can see that's being exercised by Gila River in this case, but I think that states should defer to the tribe for schools on the reservation, and I think other jurisdictions should also defer to the tribe, because tribal leaders don't differentiate tribal youth by what school they go to. They have responsibility over all students on the reservation, and I think that's something that's important to realize. Looking forward, a couple things, given that this is going to be a long-term issue that we're all going to be dealing with for a long time. One of the first things that came up that was food related during the crisis was the fact that I think we all probably faced a run on your local store, right? Your grocery store. That happened at Gila River too. There were limited supplies outside of the reservation. Despite being so close to Phoenix, the reservation itself is what you would consider a food desert. So that was one of the first issues that needed to be addressed. There were unfortunately some issues when some members went off reservation. Sometimes, I mean, this crisis hit everybody really hard, and sometimes I would say historic attitudes came out. So there were some folks who left the reservation to try to go to some other areas to access food, and the interactions were not positive. So the governor has wanted to address food security for this and any other health and economic crises that may come up. So the community took over a mini mart on the reservation and is going to use that mini market to implement its FDIPR plan, its FDIPR program. But the other thing is food trucks. So the idea is that each district will have its own food truck that will bring a farmer's market to each area so that there's fresh fruits and vegetables, working with Gila River Healthcare on kind of some cooking programs, nutrition programs, and recipes that can be used for those foods, as well as instituting a delivery service for elders on the reservation to make sure that any of the families that have special needs or elders can have food delivered to them from that source. So that's something that we're working on that we hope to implement within the next 6 months to try to address this need going forward. And it's really easy to see how once this crisis is over, those food trucks could be used to educate students, work with students. Gila River is an agricultural community, so there's a really good tie-in there with how to bring the farmers market foods to the schools too. So that's a little bit about the community. I know it's a big overview, but I think there's a lot to be said for community decision-making for students and families, and making sure that everybody has the nutrition they need to really thrive in their environment.
Wow. Thank you so much, Denise. You shared so much and had so many great stories. And I liked how you mentioned, and it really kept bringing up the need to work as a community and recognize the whole community. And yes, you can solve your own problems. That's so great. So thank you for all that you're doing. We are going to hear from our next group of speakers. We have the St. Michael Indian School representatives, which are Melissa, who's going to speak, Dee, and Renee. And we will turn it over to you, and then we have questions after that.
Wonderful. Good afternoon, everyone. I'm going to start us off. My name is Renee Ticini. So I'm going to give you a little intro of St. Michael Indian School and our community here. So St. Michael Indian School, as you can see, was founded in 1902 by St. Catherine Drexel. So we are a nonprofit private Catholic education. We do preschool all the way through high school. So we serve the littlest to the oldest, from cap to cap, we like to say. And so, yeah, so that's our school. Next slide, please. So who we serve. So in our pre-K through 12th grade this year, we have 342 students. Of those 342 students, we have 82% that are on scholarship. So we participate in a lot of scholarship programs within Arizona state, which allows us to, I believe, have a larger enrollment. We're the only high school in our diocese. We are part of the Diocese of Gallup. Although we are located in Arizona, a lot of people confuse us with being in the Diocese of Phoenix. We do collaborate on some programs with them, however. And so in the area we serve, this picture is just, if you were to come off of our school down our driveway to the main road, you can see our little sign there that says St. Michael Cardinals, home of the Cardinals. And this is part of St. Michael. So it looks over, you know, the plateau there. And if you keep going, you'll hit Gallup, New Mexico. So we're located right on the border, state border of Arizona and New Mexico. So we get students from both Arizona side and New Mexico side, which is a challenge when we're looking at residency, and also servicing students as well. We have a 99% Native American enrollment. Again, we are situated right in Navajo land, the heart, the capital of Navajo land, Navajo Nation. And most of our students are Navajo. So we do have that cultural piece built into our education. We integrate that into language and cultural classes here, which begin in the elementary level, and then they go more heavily into language and government in the high school levels. And so we do, that's most of our constituency. We have 64% on free and reduced lunch. So that kind of gives you an idea of the family's income levels in the area. And so when we look at, you know, who we're serving, we really have a range of students. We serve students from not just locally here, but some that travel as far as about 31, 34 miles away up in the mountains. As you can see, we're surrounded in mountains. A lot of people think Arizona's a flat desert cactus, but up here in northern Arizona, we get snow. We're at an elevation of about 6,800 feet. And so we get snow, and we see all the seasons here. So we're really kind of a hidden gem. Next slide, please. So our community, as I was mentioning, we are on Navajo Nation, which is the largest reservation in the United States. In St. Michael's, our population, you see, is estimated at about 1,218 in just our little area here. We're right next to Window Rock, which is a hub of both tribal entities and federal government. So what's estimated is that there's at least 20,000 people during the workday. And then in the evening, once 5 o'clock hits, they all go back out to their surrounding communities. So a lot of people wonder how we can get students from so far, and that's why. Their parents come in to commute for work, and then at the end of the day, pick them up and take them back out. So that's a sort of where we get a lot of our students from different communities that surround Window Rock and St. Michael's area. The picture here is we had a flag raising ceremony. And so our students gathered outside. Our school was built, as you can see, is 1902. So we have a lot of stone masonry, very homey, I like to say, look to the school, which provides a lot of challenges on its own too, as far as technology upgrades and remodels. When we look at the families that we're serving, a lot of our families are multi-generational, meaning that they've been in the area, maybe their parents or their grandparents or their great-great-grandparent attended our school. So there's a very heightened sense of community and school pride, and definitely education pride with our school, and we're very pleased about that. So we have families who grow up in the community, maybe leave for school and return, or either they've always been in the community. We have, when we look at employment, when we were looking at, statistics of the types of employment that we have here in the area, the median household income for our area is about $47,000. Although we have a poverty level of about 31%, which is actually higher than the normal poverty rate level in the country. And so when we look at, again, who we're serving, we were a mission school, so we're mission-based, we're a nonprofit. We really look at, are we bringing those education and that mission to the school? Are we delivering that to every student? So when we look at, we talk about these differences in economic hardship, financial hardship. It's really important for us to review families case by case to see how we can help them, not just with scholarship and helping them with education, but also all the way down to helping them with school supplies and uniforms and things like this food nutrition, which has come up so in our face most recently. But we've been aware of it just because we like to utilize a lot of programs that have been put out. So through No Hungry Kid, we've actually been a recipient of a couple of other different programs because we've been looking at how do we bring nutrition to kids for health reasons, but also the school nurse. We have an excellent school nurse, Jamie Adams, and she gets visits by students every day. And this started happening when she was able to see, because she's been here with us for about 5 years now. So when you see the trends of what's going on, and we can evaluate it. So we're really kind of became family centered, if you will, looking at the relationship between the school and the home, and what can we bring to the home. So in that sense, recognizing multi-generational, preserving language, bringing culture in, and that was really important for our families. Even though we're a Catholic institution, this is the people that we serve. And so we always have to remember that to be culturally relevant in anything that we do, in education and even in food nutrition, as the ladies will speak to you later on about. But during this whole family-centered focus, we also, this really kind of happened to right when COVID was hitting. And we noticed a lot of changes within not just our local community, but of course across the nation. As a Navajo Nation, we're all over the national news, even world news is one of the hottest spots in the whole world for the pandemic. And the Navajo Nation government, which runs a lot of their own programs, they have a great Department of Health, and they track every case and they monitor and they put out health guidelines. And those are basically the guidelines that we have followed in order to reopen with our school. And that's really important for us because we need to not only just follow what's happening in Arizona State, but what's happening in tribal government. So when we look overall at what happened with us, and you're going to hear a little bit mostly about what we did through COVID, our processes moving through COVID, but in food service, but also you're going to hear a little bit about what was happening before then. But overall, the cases, the death cases on Navajo Nation were 574 confirmed. We had 10,969 cases that were confirmed positive, and then 7,396 cases that were recovered, so people that recovered from that. In our area, which was again a heightened hotspot in Fort Defiance, we had what our area, sort of where we are, where St. Michael's is, we're in a region, and Fort Defiance is that region, and we were 1,138 cases total today. And so when we look at these numbers and we look at how are we running a safe program, we have to take all of that into accountability. And Dee and Melissa will kind of go over exactly how that those numbers impact what we do, what we package, what we serve, and how we operate on a day-to-day basis. And through our leadership here at the school, how we've been able to execute that all the way down to what they're doing every day. And so, yeah, so that's, again, a little bit about our school and where we are. And at this time, I will turn it over to Dee and Melissa.
Next slide, please. All right, so delivering food to kids, we do a few different options. Monday through Friday, we have basically like a curbside pickup from 11:30 to 12:45. So families can drive up. You can see in the picture on the right, we have our cooler set out in our parking lot. The families come up and tell us, I have 2 kids, I have 5 kids, and that's how we get the meals to them. Also Monday through Friday, we have a bus delivery service. So we deliver to 4 different areas on our reservation. And they do the same thing. It's basically like a drive up. The parents tell us, I have 2 kids, I have 5 kids, and we deliver the meals that way. We also have 2 other options. As Renee was saying earlier, we have families that live half an hour, 35 minutes, 45 minutes away. So we implemented weekend bags and weekday bags. For the weekday bags, they pick them up every Monday, and they have meals for every day of the week. So they have meals for Monday through Friday, breakfast and lunch. And we also do the weekend bags. They can get picked up on Fridays, and that'll have breakfast and lunch and a snack for Saturday and Sundays. So those are a few different options that we started. We just implemented the weekday bags not too long ago in the delivery service. Starting, I believe it was the beginning of September is when we started those. Next slide, please. And Melissa. I'll turn it over to Melissa for this slide.
Oh, shoot. Okay, I'm sorry. Here we're preparing to load the buses, and the vehicle to delivery. As Dee mentioned before, we serve weekday bags and weekend bags. And recently we started doing shelf-stable items for families that do not have running water or electricity, which is something we've learned recently. So we had to deal with that like on the spot. And so Dia had to run down to Bash's to get like shelf-stable milk, which comes in a box to give to families that cannot refrigerate their milk, and other food items like canned milk, canned soup, stuff that you can just heat up real quick, like on the stove or whatever. And that's what we decided to do for our families that are in the area, just so the kids can eat like breakfast and lunch. Next slide, please. Here we are getting the colored bags in the corner are weekday bags that we're preparing, and weekend bags. That's what we give them out with them, and then they bring them back so we can reuse them. We wash them, sanitize them, and we give them out again for the next week. And in the top, D is delivering to a mother. And in the middle, we're preparing lunch.
Like Melissa said earlier, we've had to do a lot of menu adjustments. Like she said, we do. So every day we get a lot of students. They're very consistent when they're coming to pick up their food. So we learn the families, we have conversations with them, and sometimes they'll tell us that we don't have electricity, we don't have running water. So when we, for instance, our breakfast, we had to do a lot more prepackaged foods. The prepackaged cereal, prepackaged oatmeal, breakfast bars, things that we know that they can keep safely in their home for breakfast for the next day. But we always make sure to have a hot lunch for them. Every single day we do a hot lunch for the students. And like she said, sometimes we need to run down to our local grocery store, buy the shelf-stable milk. Yeah. Anything else to add, Melissa?
Not on this slide.
Okay.
Next slide, please.
And this is another thing about the menu adjustments. Normally when we're in school, we have parents tell us they have a special diet or allergies. So this time around when we're delivering food, we try to keep certain things out that are like allergies, let's say peanut butter or any kind of nuts we try to keep out of our food delivery service. And it has changed our food purchasing options just so that we can try to keep those shelf-stable foods for the students. If we do have the option, we do try to get in the culturally relevant foods. Blue corn mush, we'll do Navajo tacos, we'll do pozole. Yeah. But I mean, it's an adjustment for everyone right now. Next slide, please. And these are a couple of the food programs that we're working on right now. The FDPIR, Melissa works with USDA a lot. We're also in the process of doing the farm to school. We had our official interview, sending in our soil samples. And we are currently, so what we want to start doing is adding into like our weekend bags for the nutrition education. We want to add in activity packets for the kids to do fun facts, stuff like that. So when they're at home, they might have like a puzzle they can do, but they're also learning about the food that they're eating, the food that we're sending home for them. And another program that we started just this last year is Breakfast After the Bell. Before we would have breakfast before school, kids would come into the cafeteria and we didn't really have too many kids eating breakfast. And then, so we started breakfast after the bell, and that doubled, maybe even tripled our breakfast participation when we started that. And we actually got a grant through No Kid Hungry, and we were able to purchase a breakfast cart. So that is another thing that helped us like significantly increase our breakfast. I saw kids in high school who normally didn't eat. They were finally going to our breakfast cart that we put into the high school. And we were also able to utilize that for lunch. So we were able to do maybe sandwiches, salad, just little things that they can go pick up in our little Pride store that we have at our school. Melissa, Renee, do you have anything to add?
Another thing with the breakfast after the bell that I enjoyed was like having all the kids come into to the cafeteria. Just like lunch, they all come in, they all sit with their class and they have breakfast. Like if they wouldn't have had a chance to get breakfast in the morning, they could get breakfast at school and it would be a hot breakfast.
Yeah, I think just to add to our food programs is that our food service has really sort of built a reputation with our students to delivering healthy, they probably don't even know it's that healthy for them, but nutritious meals that are fun, and they always add new different things. And you know, I hear kids saying like, oh, what, you know, that was new, or ooh, what is this? And so I think bringing the fun to food is really important, because, you know, you're introducing foods to them that they may not have access to at home. And so it's kind of a little fun piece of the fun programs, the food programs that we do. And I think, again, just when we really look at the weekend bags, I know that was mentioned earlier, but with the weekend bags, that's really important, because these may be some of the meals that the only meals that some of these kids are receiving, because we are in such a high poverty situation here, and a lot of people are working furlough, or they're working part-time now rather than full-time, and it's impacting the economy. And just to make it a little clear, we're not tribally funded, even though we're on the Navajo Nation. So our funding is very separate. We work a lot with state programs, which has been critical and crucial during this time, and also organizations like No Hungry Kid, the Share Our Strength organization, who helps to fund some of these areas that normally we don't budget for. Every year, our school is always, when we budget, always actually goes over budget, because again, our leadership is very dedicated to making sure that we serve meals and that we're feeding these children. But also in that process, we're able to really look at what are we doing for the community. And we've seen huge increases of not just our students coming, but also community students. So we're serving students from age birth, I guess, all the way up to 18. So that wide range of students. And so really just seeing a lot of the community, and we've become this hub of you know, I guess maybe security and safety for our community through the food programs that we're running. So just wanted to add that little piece.
Wonderful. Thank you so much, Renee and Melissa and Dee, for sharing, and also for Denise earlier. So great to hear from the great work you're doing with St. Michael's Indian School, and then to hear from Denise and the Gila River Indian community, just the themes that we heard around not isolating the school from the wider community, the importance of tribal sovereignty and the oversight, administration, how these programs are actually rolled out, how they're administered within communities. And then just inspiring, hearing Melissa and Dee just feeling so, and Renee as well, feeling so inspired how you're meeting families, how you're providing those meals and addressing the needs that you're encountering during this crisis. And also how you're doing all of this. I mean, it's kind of incredible you're able to do this while also, taking into account the safety precautions. And in the risk to, potential risk to your staff, and keeping yourselves and your community safe as well in the middle of all this. So thank you so much for sharing. And I did have a couple of questions that came up just to kind of build for Renee, Dee, and Melissa. Just folks had a couple, kind of clarifying questions about your program that I thought we might start with. In terms of the weekend food bag program, was that a program that was operated, was that funded through donations? Was that funded through some of the USDA programs and some of the waiver flexibilities that were provided? And then Melissa, there was a question that folks are curious what the breakfast cart was like. So if you folks, I was wondering if you might be able to answer a couple of those questions for folks, and then we can dive into some others that have come in as well.
Well, the breakfast cart is like basically like sort of like a food bar, little food bar that have already packaged items like a salad, like maybe a chef salad, or a sandwich and some veggie sticks. Or in the morning it would be maybe oatmeal that you just pour water in and heat up, cereal and milk, breakfast burritos, just items that kids can pick up, like the high school kids can pick up right away and they can take with them.
Right, and just to add that it was more of a grab and go, because what we noticed with our, so when we started Breakfast to the Bell, the idea was to have them eat in their classrooms. That kind of went belly up because there was so much cleanliness and food transportation, and you kind of saw while our school is all different levels and all different buildings, and so that became a challenge to get food out really quick and then back and cleaned up in time to be accommodating to the teachers' schedules for the learning that needed to happen. So what happened is kindergarten through 8th grade ended up just coming to the cafeteria, having their time, and then getting back to their classrooms. And that was where we could feed them. In 9th through 12th grade, which is our high school, they had easy access to that grab and go. So what they preferred and what we found out is that they didn't really want a tray with all these options. They were like, give me a burrito. Give me a sandwich, give me a fruit and yogurt, a parfait, something that they could easily just eat while they were walking down the hallway, and then, be done with it by the time they were back in class. So just really paying attention to what the students were eating, and making it cool to eat at school. Everybody was kind of like, did you eat? And I guess this acceptance too of our teachers saying, hey, why don't you go down the hall and grab something if you haven't had anything? And so just kind of that community support that we see. In terms of, I think you said, that was the breakfast cart, but the other, I saw you were asking about donations or how that funding happened.
Yeah, I think there was a question for the weekend food program, how that program was funded.
Right. So from the get-go, our president, Dr. Testo, is a big advocate for feeding children. And so we've actually been wanting to do a weekend program for a couple of years now, but we were trying to figure out how to do the funding for it. And so when this happened, we knew it wasn't really a choice, it was a necessity. And so our leadership said, let's do it. We know it's going to cost, let's just get it done because we need to feed these kids. So in the beginning, it was really just coming out of our own budget. In showing the work that we were doing, because when we closed campus in March, middle of March, the only people on campus were our food service program and our maintenance staff. And that was just to really not compromise any of the food service that was going on, because we weren't sure at that time, as a lot of people were, how it was being transmitted or what this really was. So we, as a school, we're very supportive to say, let's just kind of everybody work from home and do what we need to do, and the learnings from home, and let's not compromise the meal program. So in that process, a lot of people heard about that we were here, and we had this outpouring of support from private donors, from organizations reaching out saying, hey, we know that this is going on, let's talk about how we can help. And so we were, then there were some changes in some of the food programs. I don't know the exact acronyms. I think Dee or Melissa can help me out with that. And then that switch came over, and we were able to get reimbursed for some of that, which was really exciting for us because we don't have a huge budget. But also, just the fact that, like, hey, we just got to put it out there. And, as as a Catholic institution, we just got to say it was in God's hands, and we just have to just move forward in that faithful way and do what's right for our community. So yes, so a little bit of both. And then there was the transition, and we're really excited to be able to get reimbursement and get support from organizations who had a very, very high turnaround to seeing the need. Even like Cisco, who's our food partner, who does our food deliveries, they were very responsive and working with pricing and getting everything that we needed because everywhere, everybody was wanting the same kind of items. And just really having that one-to-one personal connection. We weren't just a sales school to them, we were really important and they knew it. So I think this kind of gave us an experience with those relationships and people really caring about, are we able to do what we need to do, and let's help you get it done. So from all over, so. Yeah.
Melissa, feel free to fill in anything else you'd like to add. I also just want to call out my colleague Janine into the chat box the links to a resource that has some additional information so folks can visualize some of the equipment that Melissa was describing earlier as well. So anything you'd like to add, Dee or Melissa, to what Renee shared?
Well, with our food company, Cisco, like in the beginning when everything was like barely starting, we had a hard time getting the stuff we needed, like prepackaged items, prepackaged food. And so most of the times we had to package stuff ourselves. And then because like a lot of schools were already ordering the stuff like that. And so we had to kind of improvise to get food out there for the kids. But after it kind of like leveled off, they started getting items back in stock. So which was a big help.
Yeah, absolutely. And Melissa and our two other food service workers, like I said, we do a hot meal for lunch every single day, and all of that packaging, it's all in-house. Melissa and our other two food service workers, they do all the packaging for everything.
That's great. Thank you so much. That's really helpful kind of context for all the incredible work you're doing. Want to take the questions in just a slightly different direction, and Denise, follow up on some of the things that you had shared earlier. And really was a question that came in as we heard from our registrants as they registered for this webinar. We've seen in the Q&A. But as tribes and partnering organizations advocate for tribal sovereignty over federal child nutrition programs and others like FDIPR, could you just paint a picture of what that advocacy looks like in practice, and how can food justice advocates raise awareness of how important it is to transfer some of that power from federal and state governments to tribal governments as it pertains to nutrition programs or other programs that are, that really have an impact on, child hunger, but also child, the ability of families and children to thrive in the community?
That's a really good question. I think the first step always in advocacy is awareness. So everybody who is on this webinar today is now an advocate for Indian country because you can't, once I think you learn about Indian country, once you know about the issues, you can't unlearn that. And I think everybody here is passionate about serving underserved communities, making sure that the most vulnerable in our society have equity and have the basic foods that they need to thrive in their situation. So I think first is awareness. Second, it's funny, when I entered advocacy, everybody thinks that advocacy for Indian country is writing long bills and making sure that, that tribes have their own separate legislation. But I found that the most powerful way to advocate is add 5 letters to a bill, and that's TRIBE. So when you think about states, when you think about local governments, think about tribes. When you think about any of the local schools, the public schools, the parochial schools, the charter schools, think about tribal schools too. It's really an awareness and an inclusion to understand that every there are very few pieces of legislation that impact food programs that don't impact tribes. I am stretching to think of one. On FDIPR, the main priority is self-governance. And in most of those areas, it's making sure that tribes have the ability to make those decisions locally. I mean, you see from the panelists from St. Michael's, what they're doing on the ground is making a difference in their community every single day. We just want to be empowered to do that.
Thank you so much, Denise. And while we're on, this topic, a related topic, I guess, is, can you expound upon what food sovereignty looks like to you, to the Gila River Indian community? And I would also open that question up to our panelists from St. Michael's if you'd like to share as well. But Denise, anything you'd like to share on that question?
Yeah, food sovereignty means making all of the decisions needed for the schools. Sourcing, like I mentioned, there's Gila River Farms, there's Ramona Farms that are right there on the community. They service the restaurants on the reservation, they service Gila River Healthcare, but there's a barrier to those particular farms servicing the schools. Like that shouldn't be. And it's just really because of regulations and barriers that exist. So, sovereignty means sourcing, deciding what's in the food packages for families and students and what the students are eating and how they're learning about food. At one of the schools, Gila River Crossing, that's a BIE school. And at the new Casablanca school, there are agricultural areas. So the idea is for the students to grow their own food and then eat their own food, learn how to prepare their own food. That's what we're working on there, is really from the ground up. And by learning the agriculture, the students are learning their history as well. So it's really a comprehensive, it's not just here's a tray, it's we grew this. It's part of our history, it's part of our culture, and incorporating everything into how students view their food.
Great, thank you. And I would put that question as well over to the St. Michael's team, and also curious to hear from Renee or Dee and Melissa about any needs or challenges that you found to be most pressing during COVID-19, and how can organizations best support and elevate tribal communities at this time?
I could start. So as far as food sovereignty, because we have such a long history here, our school's been here for a century. When we look back through our own history, we look at how our school sustained itself. So they grew their own, they had their garden, they actually had some animals here that they milked, and they did a lot of that here. So when we look at sustainability, or ecology of our own land, we have quite a bit of land here on campus. It's sort of in our history here at our school that we do that. And so what we've been hoping to do is reintegrate that, especially being culturally relevant. We have two types of gardens on campus. I wish I put those in there, but we have 3 different levels of gardens that we do, which grow everything from asparagus to pumpkins, and you saw the corn stalks. And then the detrimental thing is we weren't able to bring it in to the school. We could give it to staff and say, hey, we have this, but we couldn't feed it to the kids. So through the program Farm to Table, we're hoping to get everything, soil samples and water samples and everything approved so we can do that. And then also that'll help enhance our curriculum that's happening in the classroom, to also plant that seed for those kids that may be interested in agriculture and STEM education, and down the line being able to turn around and say, okay, I want to go into agriculture, or I want to do this type of work. And that's really important for us as an education institution to have that available. So when we look at what's happening on campus, that's with our regular garden. We've planted fruit trees, taken out non-native plants on campus. Through the great work, we work with an individual, his name's Joe Bacall, and He's helped turn our campus around. So he's helped remove a lot of invasive or non-native plants on our campus and replace them with native plants, and also planted fruit trees. So if you come to our campus, you're going to see a lot of fruit trees that we're able to harvest and then bring that into the kitchen. We also have a separate side, what we call native plant garden. And it's really just sort of scenery because it's a lot of things you probably can't eat, but what's really interesting to us is that we may be able to set up an area that, traditionally students would have access to these herbs that are typically way out in the mountains and they would have to go get if they were going to use them in a traditional sense. And so being able to provide that there where they have that at their fingertips to learn about really sort of brings that full circle for us in a way as well. So when we look at the decisions, and again, we're a little different than Denise in her group. She's got, making for the whole decisions for her whole tribe. We're just one school on the reservation. And the Navajo Nation is comprised of a lot of different types of education institutions. So there's BIE, which stands for Bureau of Indian Education types of schools. We also have tribally controlled schools, which, they call them grant schools. We have public schools. And Navajo Nation sits on 3 states. So we sit in Arizona, New Mexico, and Utah. So we have public schools, and then we also have private schools, private institutions like ourselves. So there's a whole lot of different schools. And so I don't speak for Navajo Nation as a whole. I just speak for our piece of what we do here. And so I know what those challenges are is that what we've seen and what's been really great is that people from outsider communities who know that we have this need are actually reaching out to schools, and we've been able to help channel some of that, either redirect them to the place that it should go, or we've been able to say, yeah, let's help coordinate, because our kitchen or our principals, they have one-on-one knowledge of what's going on with students, but also what's happening in the community. We don't have a lot of food pantries. If there are any food pantries on the reservation, they're very small. They're probably sort of maybe mom and pop run, or they're run through the church organizations in that little town. They're not full scale. So when there was all this coordination of what was happening to get food out to the community, they reached out to schools. And that was really important because we were able to say, hey, with the resources we have with social media or parent connections, to say, this is what we're coordinating and this is what we can help do. So that was a really nice collaboration. And I would suggest that they continue to reach out to schools, because this is where, number one, where the children are. And that's really our focus was the children 0 to 18. I know Denise also did elders and other community members, but really that really was helpful to continue that collaboration. And also a lot of tribal offices were closed, so they weren't able to get through and they weren't sure who. And so I think it was really important also for schools to be aware of who's in the community, and let's all work and partner together. So for example, we did some work with our local public school and some other local nonprofits as well to get coordinated efforts like Navajo United Way. And then there was a big fundraiser with some other artists across the country, and just channeling all of that in. So definitely reach out to schools because they have that face-to-face with the community.
Great. Thank you so much. And I just want to, but we do have questions coming in. So if folks are able to hang around for a couple more minutes, we can get to some of those. If the folks are okay with that. So I'm actually directing this at our panelists too. I think, they've already exceeded the allotted time that we asked of them. If you're able to stay, we can ask a couple more questions. Otherwise, I'm happy to, we can go kind of any final remarks you might have and we can close. So I guess the participants can make their own decisions about whether or not they want to stay or go. But I see we do have about 55. We have a lot of folks who are still on the line here. So I guess I'll just put that out to see if there is an availability or a willingness to stay on. We can answer a few more questions or we can wrap up.
Okay.
Great.
I
Okay.
think we're good. Yeah,
Okay.
I think we can continue.
Okay. Well, we did get one question that I think folks would be very interested to ask, and it was on one of the slides that I think Dee and Melissa were sharing about Provision 3. There was questions about the implementation of Provision 3 at the school and how that's looked during the pandemic in the context of waivers and any changes you anticipate post-COVID. Is that something that you would be able to speak to in greater depth? And I appreciate you bringing that up. Provision 3 is not necessarily something folks hear a lot about.
Yeah, absolutely. This year was actually supposed to be our base year for Provision 3. And it's a completely new program to us. We've never done it before at the school. So far, since USDA extended through June of next year, we decided to stay with the SFSP, I believe, through the rest of the school year. So for Provision 3, we're going to be starting next year in August when we come back in 2021. With the waivers, our specialists through the Arizona Department of Education have been extremely helpful. They send us everything and say, hey, let's do this waiver so you guys can maybe just have parents come pick up food without the student needing to be there. But our specialists have been amazing with helping us transition, starting with NSLP over to SFSP and then getting started with Provision 3.
Great. Thank you, Dee. And this is a question that I think is directed toward the St. Michael's team, but actually, Denise, I think it's something you alluded to as well. It was about the regulations prohibiting kids from consuming school-grown fruits and vegetables. Denise, based on what you shared earlier, or the team at St. Michael's, kind of expound upon some of those limitations that you're navigating, or those regulations that you're navigating in that context?
Yeah, and the St. Michael's team might be a little bit more on the ground with that, but I think there are certain restrictions about what I think I probably, and I may have misspoke a little bit because I was thinking about FDIPR in that aspect. And one of the things we've been working on for the FDIPR program is allowing those school-grown products incorporated into the food distribution program. And there are certain restrictions and waivers that are needed that have been really cumbersome for tribes. And it's something that we've been working on. I think in the last Farm Bill, there was a pilot program that would allow tribes to incorporate their own cultural foods. But it's really been slow going. And again, I think sometimes there's a view that tribes don't have capacity or the nutrition wouldn't be there. And I think that it's kind of a misstep by USDA to not allow tribes to have a more personalized program for their communities.
And there are a lot of restrictions when it comes to getting the food onto our tables at the school. We have to do soil tests, compost tests. We have to do rainwater tests. They take a look at how our garden is. We have to map out everything so they know there's no maybe runoff, oil runoff, or anything getting into the soil at our school. But we've been, like I said, all of the specialists that we deal with are very helpful. They let us know everything we have to do for the application process, and they help us out a lot with getting us approved to get that food onto our tables for the kids.
That's wonderful. That's great. Thank you so much. And I do just want to acknowledge that we are over time. And so I guess I'll just say, I want to thank all of our panelists, Denise, Dee, Melissa, Renee, thank you so much. I would love to, if there are any final thoughts that you have, I will definitely open up again before we wrap, but I also want to take a moment as well to thank my colleagues Janine Rios and Chelsea McCormick for helping bring this together. Chelsea behind the scenes, keeping us organized and navigating the technological challenges. And just a reminder as well that we'll be sharing a link with the slides and the recording from today's webinar. But Denise, I'll come over to you first with any final thoughts, and then I'll hand it over to Renee and Dee and Melissa with the St. Michael's team, and we'll close with those. So thank you again, and I'll hand it over to Denise.
I think just a big thank you. So often in Indian country, we find ourselves in kind of our own bubble, and it's been the last, week or so, 2 weeks, working with you and Janine and getting to meet the St. Michael's team, and it just, I can tell that you all are a community too, just like tribes are a community, and it feels really good to be welcomed into your community this way, and to work with like-minded people who, I would say advocacy is most effective when you lead with your heart, and I see that in all the work that you're doing, and I just want to thank you for allowing me to be part of it.
Thank you so much, Denise.
And I just as well like to thank everyone for joining. It's so exciting when you get to, every day I don't get to step into this world. I do a lot of other things for the school, but I get to collaborate a lot on what's happening with our food programs and some ideas, and working with Melissa and Dee over the last couple of years to really get some of these programs in the school and to see what other schools are doing, and to really bring that nutrition education, especially now as we look at sustainability, we look at what's appropriate for our climate. And I think that's just really exciting to know that so many people are interested in what's happening here, and to continue to move forward to make good decisions for our communities, because just like we're one community here, there's so many communities the same way all across the nation, that don't necessarily have to be tribal, but maybe they are rural too. So but just really excited to be here and be part, and thank you for asking us to be part and share our story with you.
Wonderful.
Yes, it was great to meet all of you guys. It was very interesting hearing from Denise, seeing a different side of the food service program. Definitely learned a lot today. I had a good time meeting all of you guys.
I would also like to thank everybody for joining us and hearing our story of with St. Michael's. And I'd like to thank No Kid Hungry for all the programs that you guys put out so we can to help us get food out to the community. So thank you.
Well, we thank you as well. And so with that, we'll wrap up. Take care, everyone, and we will be in touch.